many of us believe we are leaders? The truth is, we are all called to lead. While many of us may not lead historically, like Nelson Mandela, who professed that great leaders lead from the back, and also believed that in order for one to be a great leader, one had to speak last, or like present-day Simon Sinek, who champions the cause that leadership is never quitting on others. We can all think back to a time in our lives when we were called to lead. I can think back to my own defining leadership moment, and I will share with you when I was called to lead. It was May of 2020, and we were a few months into our COVID pandemic experience. The ensuing uncertainty and trepidation created the need for a collective dental hygiene voice. I used this collective voice and cause as my spark to create this National Dental Hygiene organization. I have been called to lead. Leadership means many different things to many different people. Leadership is seen in the gentle way a mother duck walks her ducklings across the street, and the powerful way a general leads his army into battle. And while these different leaders with different leadership styles invoke different concepts of leadership for everyone, the reality is they both share a commonality. Both were called to lead. Leadership, in its definition, encompasses quite a few different aspects. We look at the definition of leadership, and scientific research and journals are fraught with lengthy explanations of what leadership is. They encompass the core principles of a practical skill combined with your ability to disseminate the information. Leadership is a skill set that can be learned by everyone, and we're all called to lead. Moving forward into our leadership circles of influence, we can look at the word lead, and we can look at the letters and disseminate what the acronym could mean to us. We'll look at the word L for lead, and we see listen. So in order to understand, first we must listen. Next we see E, which is empathize. So in empathizing, we will be prompted into action. Next we see A, which is ask, and we should be asking how we can support. And then D is deliver, and we're going to deliver to the best of our ability. These tasks sound simple, and great leaders have mastered this art and science. For us in dentistry, as dentistry is advancing, we need to be aware of our leadership circles of influence. For all of us, many circles exist. These circles of influence start at a core circle, and they disseminate their influence to outer circles of our influence. For all of us, our circles contain different people and different groups, but the reality is they all share a commonality. We all have the opportunity and responsibility to lead. Leadership and these leadership circles of influence are patient-centered. I will share with you what my leadership circle of influence look like as a clinical dental hygienist working in the DSO space. My inner circle of leadership is patient care. So I have the ability and responsibility to use my leadership to bring my patients into health. Whether you are a new graduate or a seasoned professional, our patients rely on us to inspire them towards health, to instruct them, to guide them, to bring them to health. We owe all of our patients responsibility to listen, empathize, ask how we can support, and deliver health to our patients. Moving out from patient, the next leadership circle of influence is your hygiene department. So in the hygiene department, I collaborate with my fellow hygienists to lead. We lead each other, we empower each other, we influence each other. That's our responsibility within our hygiene department. Hygiene departments can vary in size, whether there are 2 of you or 12 of you in your hygiene department. We have the responsibility to elevate each other. Leadership within your hygiene department among all hygiene department members will ensure that your hygiene department is successful within your practice. Moving out from your hygiene department, the next leadership circle of influence is with your doctor and your team. So using leadership within this circle, I have the opportunity to co-lead with my doctor and to influence leadership and growth among my team members by listening, empathizing, asking how I can support, and delivering to the best of my ability. I have the opportunity to create alignment with my doctor towards his vision for the practice and to create synergy among the team members to bring our patients into a situation where they have the ultimate patient experience. Moving outside of that leadership circle of doctor and team, the outermost circle is the dental hygiene profession as a whole. So here, I have the responsibility and the opportunity to create excellence within the hygiene profession. We have the opportunity and the experience provided as a whole, dental hygiene profession as a whole, to create for our patients optimal patient outcomes. Listening, empathizing, asking how we could support, and doing this ability as a hygiene department as a whole, we will ensure elevated patient outcomes and growth for our patients and our practices. So whether you are exercising your influence among your patients, your hygiene department, your doctor and your team, or the hygiene profession as a whole, we have the responsibility to create a mission where we share best practices. That was the foundation for our National Dental Hygiene Organization. Doing this ensures that we will champion a future for patients in dentistry where excellence occurs. Both within these leadership circles and beyond, great leaders ask others to lead. Great leaders create leaders. Great leaders empower others to lead, nurturing a quiet confidence and igniting a fierce spark. So in light of all of this, I will leave you with one parting question. How will you lead?